The other key infant and young child feeding practices include early initiation of breastfeeding within 1 hour of birth. This is then continued up to 2 years of age or beyond, with the introduction of nutritionally adequate and safe complementary foods at 6 months. The Ministry of Health is committed to greater awareness, raising and supporting of breastfeeding through implementing policy guidelines on maternal, infant, and young child nutrition. These guidelines outline strategies for strengthening capacity of healthcare providers, communities, and stakeholders. Additionally, Kenya enacted the Breast Milk Substitute Act of 2012 in line with the International Code of Marketing of Breast Milk Substitutes, providing for appropriate marketing and distribution of breast milk substitutes and promotion of breastfeeding. At the community level, the Ministry is rolling out baby-friendly community initiative to empower communities to promote, protect, and support breastfeeding and address the barriers and negative breastfeeding perceptions that prevail among our elitist young mothers. Our common aim, therefore, should be to re-establish breastfeeding in the country as the cultural norm, thereby making it the natural choice for the vast majority of Kenyan mothers. During this pandemic, minimizing risk of SARS-CoV infection in all age groups is important. We must say something as we talk about breastfeeding. We must also link it up with the current time and the pandemic that we are going through. Transmission of SARS-CoV to newborns is thought to occur primarily through respiratory droplets during the postnatal period when they are exposed to infected mothers or other caregivers. Although available information is very scanty, it is very highly unlikely that prenatal vertical transmission of this virus occurs during the intrauterine, intrapartum, or peripartum birthing process, as so happens with HIV/AIDS. So it's different. Transmission of this virus via breast milk is also very highly unlikely. Generally, the coronavirus infections in neonates are uncommon. But if neonates do become infected postnatally, the majority tend to be either asymptomatic or with mild disease, and they recover rapidly. Severe COVID-19 illness in newborns appears to be rare, although newborns with underlying medical conditions and preterm infants may be at a higher risk of severe illness.